We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.
Okay, everybody.
We have to get that out of the way.
Yes, we will cut that out of the way, but I am gonna, okay, it is recording. That's great. It stopped. Okay, it started recording. Okay, everyone. So here we are. Welcome.
Happy May webinar.
Yes, Happy May webinar. Welcome to the Green Nurse monthly clinical conversations webcast where we bring hope and inspiration for growth and healing. The Green Nurse podcast clinical conversations came about when Nurse Elizabeth and I merged our companies, Holistic Caring and the Green Nurse, alongside of Bloom Hemp CBD, creating Holistic Caring Network. We are in our 8th year of podcasting. Wow, it's been a long time. I've been podcasting for a very long time. And this is our 3rd year actually broadcasting clinical conversations where we explore all aspects of how to optimize and use cannabis as a medicine. And we have a saying, Elizabeth. What's that saying?
People are making great medicines, people are selling these medicines, but nobody's interpreting how to use cannabis clinically as a medicine. And that's what we do.
Yes, we do. That is exactly what we do. And cannabis nursing has been recognized as a specialty, and nurses are truly making an impact on advocating for the safe therapeutic use of cannabis. Today's clinical conversation is a very special presentation that I've put together for a breast cancer support group that we've actually been supporting over the past few months, educating them on the safe therapeutic use of cannabis. But today's webinar and clinical conversation is proudly sponsored by Bloom Hemp CBD. Bloom Hemp is woman and nurse-owned CBD emporium, championing quality, safety, and patient-centered care. Bloom Hemp features organic CBD products formulated by doctors and nurses to target specific symptoms and is Ayurvedic inspired. Bloom Hemp offers a free nurse line and free emailed care plans with product recommendations and lifestyle tips. And we do have a special for those here that are watching today. At the end, there is a couple of PDFs that you can download, as well as coupon codes to shop at Bloom Hemp with 20% savings to the purchaser, and then 20% proceeds are going to be going back to the breast cancer support group. We have Vera Ventura. I'm not sure if she's in the audience yet today, but she is a 4-time breast cancer survivor, and we are supporting her and her platform with this presentation today. So with that, we're going to get started. Breast cancer and cannabinoid therapeutics. This is a brand new presentation that Elizabeth and I have put together. We've spent a couple of weeks putting it together, making sure all the research, a couple months actually. I've been working on this for a couple of months to make sure that all the research is up to date and we're bringing you the most up-to-date information and knowledge on how to utilize this marvelous healing plant. So we have to give a disclaimer. We hope to bring you hope during this presentation, but all content provided by Holistic Caring and the Green Nurse and Bloom Hemp is not to be substitute for professional medical advice, diagnosis, or treatment, nor have these statements been evaluated by the FDA or any official agency. This is just an educational presentation for you all. So getting started, what brought me to all of this? Well, what brought me to all of this when I found myself on the other side of the bed, sick and suffering at one point in time. So this is Mary Ann. She's the person who first introduced me to medical cannabis in 2012, during a time when I was sick and suffering and on over 18 pharmaceuticals. So she was a 70-year-old retired nurse friend of mine who visited me when conventional care had failed me. I was struggling, and she actually brought her harvest, her garden. She was growing cannabis in her backyard, and she brought her harvest to me. She shared her wisdom and her cannabis harvest, offering comfort and relief when I had none at that particular time in my life. And she also disclosed to me that she had been using cannabis since she was 17 years old, a little bit of cannabis every day. And she wasn't on any ongoing pharmaceuticals, nor had she ever been hospitalized for sickness. That was pretty compelling to me. 53 years of a little bit of cannabis every day and no ongoing pharmaceutical use. I needed to take a look at that. She also revealed to me that her father was a pharmacist, and he actually carried and stocked cannabis formulations in his pharmacy prior to 1937. And that's when the prohibition hit, the Marijuana Tax Act, replacing alcohol prohibition with cannabis and hemp prohibition. And then here we are today.
Still going.
Yes. So I'm not going to get into too many details on this, on my personal slide, but I've been a nurse for 37 years this year, 25 years in the conventional system, 20 years doing holistic nursing, and then 10 years in the plant medicine arena, cannabis and psychedelics. I do have a history of doing oncology care in the home prior to getting sick. And I'm proud to be the Chief Nursing Officer of Holistic Caring and the Green Nurse, co-founder with Elizabeth, and Vice President of Nursing of Bloom Hemp CBD. I'm involved in a lot of different other organizations, members on the board, and helping really advance cannabis nursing. And I'm a contributing author to Clark's Cannabis.
And the other Mac, I am Elizabeth, and I've been a nurse 1 year longer, since 1987. Bachelor of Science in Nursing, Bachelor of Arts in Psychology. And in 1996, I finished my MBA in Healthcare Administration, spent 19 years in insurance company operations and then sales. But what happened to me is I got hurt. I went out on leave to have surgery after a bicycle accident, and was introduced to CBD at my chiropractor's office, and it started to help. I was taking it topically, I was using CBD oils, and I said, my goodness, if I can help myself, I've got to help others. And I started Holistic Caring back in 2015 in San Diego. Wrote a training manual to train my my nurses, which became the book, and that became the programs. And fast forward, Holistic Caring and the Green Nurse merged in 2021. We bought Bloom Hemp to complete the ecosystem, so that we could have good vetted quality medicines to recommend to patients. Because as you might see, some of the system has changed to adult use with the focus more on getting high rather than healing. And so we needed to step up, and we're some of the last people standing running this ecosystem of healing and wholeness. And, let's just cut right into what we do with cannabis nursing, right? There's this book, you can hold it up. Cannabis nursing is a specialty, and nurses are the only licensed medical professionals publicly supporting cannabis. There are some doctors, hi Dr. Blair, I know you're here, that are brave, but basically the AMA is wanting FDA-approved pharmaceuticals and not the botanical version. So nurses are bridging the gap and helping patients to understand and acclimate to this plant on how to use it as a medical option. And cannabis nursing is holistic nursing. So today we're going to be talking about breast cancer. It is something that many women fear. 1 in 8 develop it at some point in their life. And what breast cancer is a malignant tumor that begins in the cells of the breast, typically the ducts or the lobules. There are 3 different types: ductal carcinoma in situ, invasive ductal carcinoma, invasive lobular carcinoma. And the hallmarks of cancer cells with all cancers is uncontrolled growth, resistance to apoptosis, and that is programmed cell death, which we're going to talk about soon, and the potential to invade and metastasize into other cells and other parts of the body. Risk factors include genetic mutations, family history, hormonal influences, and estrogen plays a role in breast cancer, lifestyle factors, and an endocannabinoid deficiency, which you will be hearing about soon as well.
So what are the diagnostic treatment approaches? Well, there's a lot of different diagnostic tools, mammograms, biopsies, hormone receptor testing, because breast cancer does have different subtypes depending upon receptor status. And we're going to be getting into detail. So the estrogen receptor positive, progesterone receptive positive, HER2, which is the human epidermal growth factor receptor, is overexpressed. And then we have triple negative breast cancer, which lacks all three. It doesn't have the estrogen, progesterone, or HER2, and is thought to be more aggressive. We're going to get into each of these subtypes as we advance the slides. But the conventional system treatment modalities focuses on a lot of different things to help eradicate cancer cells and to help people reach a better quality of life. So they put together a toolkit on particularly what you have for cancer, the type of cancer, and looking at how that they can get rid of it. So you might have surgery, radiation therapy, chemotherapy, hormone blocking therapy if it's hormonal driven, targeted biological therapies, and immunotherapies. And they all do a little bit something different, but the conventional system has been programmed to use these in a way to help people kill cancer cells. Now, the issue with all of these treatments is side effects. And we have seen this with many of the patients, the majority, a big, large portion of the patients that we've taken care of over the past 10 years do come to us with cancer. And we do see these side effects all the time: the nausea, the vomiting, the fatigue, insomnia, anxiety, issues with coping, depression, apathy, appetite, weight loss, hair loss, neuropathy, body aches, bone pain, lymphedema, deep vein thrombosis or blood clots, graft versus host disease for those patients that may undergo bone marrow transplant, mucositis, which is the tongue and the mouth and the swelling in the mouth, early menopause, skin rashes, motivational loss, and failure to thrive. Well, there are treatments for these things, and cannabinoids could be facilitators.
So it's not necessarily a pretty picture when you think of just conventional care, which is why so many people look at cannabis as an option for cancer treatments. And they come to us and they're like, "Hey, Elizabeth, is cannabis curative?" Well, in preclinical research, it shows that it may help shrink cancer cells, restrict nutrients, and stop it from spreading. But on the palliative side, we know that patients are using this every day, all the time for helping them to eat, sleep, reduce pain, anxiety, nausea, vomiting, neuropathies. And the research is evolving, but cannabinoids can reduce symptoms associated with cancer of having it itself, along with the treatment of cancer. This is one of my favorite books, Cannabis for the Treatment of Cancer, authored by Justin Kander, who's the lab director of Aunt Zelda's Oil. There's a brand new edition that you can get on Amazon, and I love this book. There are over 200 new case studies of people using cannabis for cancer treatments. And really, you know, it tees off apoptosis. When apoptosis is programmed cell death. All of our cells in our body have a start date and an end date. And when they're getting sick and diseased, they self-destruct. Cancer cells don't do that. They evade that. But phytocannabinoids appear to be a biologically ideal solution to helping cancers reprogram how to turn off. And in cell and animal models, cannabinoids exert anti-cancer activity against most cancers, and their generalized therapeutic effects indicate they may fight all cancers at some level.
This is one of my favorite slides showing the cancer-killing actions of cannabinoids. So cannabinoids are molecules that interact with the endocannabinoid system, which we're going to talk about in a minute. But cannabinoids from the cannabis and hemp plant are those pleiotropic workhorses to palliate multiple symptoms and conditions all at the exact same time. So the cannabinoids kill cancer cells 4 different ways. that their research is supporting. So the apoptosis that Elizabeth talked about is the natural process of the cell cycle where the cells self-destruct when they're damaged, so cell suicide. So cannabinoids can induce apoptosis in sick cancer cells while preserving healthy cells. Cannabinoids can also provide the anti-angiogenesis, which inhibits new blood flow or new blood vessel formation, starving the tumors. Cannabinoids can also act as anti-proliferative, preventing cells, especially cancer cells, from multiplying and spreading, and also can act as an anti-metastatic, blocking cancer from spreading to other parts of the body. So these are just the 4 basic ways that cannabinoids can be used to kill cancer cells.
And there is a groundbreaking new study that is a meta-analysis where they've analyzed all of the other previous studies that have been published to date. This came out last month in Frontiers on Oncology. There's a group called Whole Health Oncology Institute publishing the Cancer Playbook and working with patients in this field. And basically, they aggregated the data and found that 70% of the studies showed pro-cannabis outcomes. 30% showed unclear results. So it wasn't pro or against, but it just wasn't a pro outcome. But what they did find is that cannabinoids can reduce pain, and in many cases outperformed opioids, especially for cancer pain, decrease the chemo side effects, especially for nausea and appetite loss, and decrease inflammation, which is a key player in cancer progression. It also increased tumor shrinkage and cancer cell death, especially in lab and animal studies, and we're waiting for the NIH to continue to advance human clinical trials, but they are going to be coming.
Okay, and this is a CannaKeys breast cancer research dashboard. So CannaKeys is where we get a lot of our research from. And you can see here that they have over 126 total studies, no double-blind placebo studies at the moment, but there's positive clinical results was 100% and overall positive 90%, which is 92%, which is pretty significant. And preclinical trials show complex interactions by the components of the endocannabinoid system and their ability to therapeutically influence breast cancer through several different mechanisms. And these are some of the things that I had talked about on the previous slide: blocking cell cycle progression, inducing apoptosis, which is cell cancer death, while preserving the healthy cells, inhibiting cancer cell migration, modulating genetic expression, and inhibiting cancer cell blood supplies, the anti-angiogenesis.
And when people say, are breast cancer patients using cannabis? Well, the answer is yes. Breastcancer.org did a survey and found out of 612 participants, 257 or 42% were using cannabis for the relief of symptoms, mainly pain, insomnia, anxiety, stress, nausea, and vomiting. 49% of the consumers believed cannabis would treat the cancer itself. 79% used it during their treatment, including chemotherapies, radiation, and surgeries. And only 39% discussed it with any of their physicians. So that's a low number. That should be 100. We encourage all of our patients and consumers to be talking about this with your providers. They need to know, and you'll find out why in upcoming slides.
So research as far back as 2007 has shown that breast cancer is highly associated with ID1, which is a gene that's linked to increased tumor growth. Subsequently, CBD and CBDA in this research actually downregulate the ID1 gene, suggesting potential anti-neoplastic activity against breast cancer and its spread.
And when we work with patients in the cannabis experience, we take a clinical approach, and that is taking a few different things into consideration. So A, what does the science and the research say? B, what does the consumer and the patient want? And C, how do we fold in real-world evidence, which is the judgment of clinicians and results from the trials and observational work, which is what a lot of us have been doing for this past decade plus, is observational work. And when we work with patients one-on-one, we provide the guidance, education, and support that they need, starting with a basic assessment, a history and physical, list of medications, what you're doing, as well as a holistic assessment, talking more about lifestyle things that we can modulate. Education and support of the endocannabinoid system and DOME, how to support the ECS with lifestyle as medicine, education on consumption methods, how to safely choose and track products, and how to follow up, making adjustments and teaching self-titration, because after a while, you're behind the wheel. This is patient-driven care, which you can see right here.
Okay, so when this is a protocol from this book here, The Cancer and Cannabis Connection. So when patients come to us with triple negative breast cancer and they want to look at a cannabis protocol, this is where we go to. We go to the research, just like Elizabeth said, we ask the patient what they want, but if they want to treat it fully, there's a protocol that it does exist, and research has substantiated in the book. So triple negative breast cancer is very aggressive and often difficult to treat. Cannabinoids, especially those targeting CB2 receptors, show promise in fighting triple negative breast cancer in preclinical models. So 10 to 20% of breast cancers are triple negative breast cancer. Again, if you look here at the image, you can see that it lacks the estrogen receptor, lacks the progesterone receptor, and lacks the HER2 receptor. And so those are targeted areas that conventional care can treat. So without targets, it makes it very difficult to treat. But the good news is in triple negative breast cancer, CB2 receptors are overly expressed, and they offer a therapeutic target for cannabinoids to plug in and to work its magic. So the protocol for treating triple negative breast cancer is CBD up to full 300 milligrams of full spectrum CBD a day, CBG up to 300 milligrams of full spectrum CBG a day, THC, high dose, full extract cannabis oil, or the Rick Simpson oil, and we're going to talk about that in upcoming slides, titrating to the highest tolerable dose, and then beta-caryophyllene, which is a terpene. And we work a lot with beta-caryophyllene in our patients, which also target CB2 receptors. Patients have had great outcomes with beta-caryophyllene, and it's non-impairing. Very beneficial.
Yeah. Shifting over to the HER2 positive breast cancer, these tumors also respond to cannabinoid therapies that engage the CB2 receptors. Whole plant demonstrates better outcomes via the entourage effect. HER2 tumors have an aggressive behavior that grows very rapidly. And Dr. Cristina Sanchez over at Complutense University in Spain found that THC and other CB2 agonists inhibit the HER2 tumor growth. Botanical extracts like fully extracted cannabis oil outperform synthetic THC in the research. The protocol for treating HER2 is taking CBD, full spectrum, up to 300 milligrams a day, CBG up to 200 milligrams a day, CBDA, which is the acidic version of CBD. This is very helpful in this type of cancer, up to 150 milligrams a day. And then THC, again, titrating up to the highest possible amount you can tolerate, a full spectrum, full extract RSO type of oil. And again, that level is going to be different for everyone. And then, of course, beta-caryophyllene, again, which targets the CB2 receptors directly, and can also block in on the receptor.
Yep. So now we're going to get into the hormone positive breast cancers, estrogen receptive positive and progesterone receptive positive. So hormone receptor status is key for choosing effective treatments and predicting outcomes in conventional care. So for these types of cancers, hormone blocking therapies are often effective, improving survival and quality of life. 70 to 80% of breast cancers are estrogen receptor positive. 65% of the estrogen positive cancers are also progesterone receptive positive, and only 1.6 are estrogen negative, progesterone positive, making them very, very rare types of cancer. So the use of cannabis in hormone positive cancers, there's been some research that has been done, and there have been some questions among a lot of people. Does THC worsen outcomes? And there is no clinical evidence that THC from whole plant medicine, the Rick Simpson oil or the full extract cannabis oil, will make any type of breast cancer better or worse in humans. But there were studies that were done that showed synthetic THC, the Marinol in particular, was ineffective in these particular cancers, particularly if CB1 and CB2 receptors were absent. So the full extract cannabis oil, the high dose Rick Simpson oil that we talk about from whole plant medicine, is more effective than synthetic cannabinoids and do not worsen outcomes. And this has been researched and substantiated and written about in this book.
And continuing on estrogen-positive breast cancer, THC may exert anti-estrogenic and anti-tumor effects in hormone-driven breast cancer. Estrogen acts on two receptors, ERA and ERB, and THC downregulates ERA or alpha and upregulates ER beta. This may limit the growth of cancer cells at ER alpha and inhibit the growth of cancer cells at ER beta. So this is really good, and it shows that it has the potential for THC to slow cancer progression in estrogen-positive tumors. And you can see some of that here. And so the protocol is going to take CBD a little higher, 300 to 400 milligrams of full spectrum CBD a day, CBG up to 150, CBDA 150, and THCA, now the decarboxylated raw THC form, up to 150 milligrams a day. So THC, we want to have a little bit more of a back seat. This shows with the estrogen positive, we want to use less THC, more whole plant, just keeping THC to 25 to 40, 50 milligrams a day, according to Dr. Goldstrich research, along with a lot of other research out there, which we'll get to here.
Which we're going to get in. So we're continuing on how CBD is better for estrogen-positive breast cancer. And these are insights from 5 key studies. So as far back as 2006, showed that CBD and CBG are more effective than THC in inducing anti-tumor effects in estrogen-positive breast cancers, setting a precedent for cannabinoid-based oncology. In 2011, Harvard Medical School study found that CBD inhibited both estrogen-positive and estrogen-negative breast cancer cell survival, triggering apoptosis in a dose-dependent manner. Back in 2018, Egyptian researchers identified multiple mechanisms through which CBD induces apoptosis while preserving the healthy cells, further supporting the anti-neoplastic activity of CBD. In 2019, Austrian research concluded that cannabinoids, while commonly used for symptom management, may also slow tumor progression, particularly in early stages of estrogen receptive positive cancers. And finally, in 2021, research from Portugal confirmed that CBD is the most effective cannabinoid for estrogen receptor positive breast cancer, with THC playing a lesser role. So this is just more research to substantiate all the different things that we have said.
Yeah, and you can really see the international global effort here in the research of trying to figure it all out. So when we talk about cannabinoids with tamoxifen and hormone therapy, we want to warn that you need a careful approach. Tamoxifen plugs in and can block estrogen, and it's a key therapy for ER-positive breast cancer. It blocks the estrogen receptors, but requires a conversion by the CYP2D6 enzymes that are in the liver, and it creates the active form endoxifen. Cannabinoids like THC and CBD may enhance or inhibit the effects of tamoxifen. Cannabinoids may inhibit CYP2D6, potentially reducing conversion to endoxifen, and this could limit the effectiveness of the tamoxifen estrogen blocking activity. But cannabinoids may also enhance the cytotoxic activity of tamoxifen, potentially enhancing the efficacy in killing cancer cells. So for those wishing to use cannabis as a treatment, concurrently, it is suggested for postmenopausal women, and there is a difference between premenopausal and postmenopausal with this, to use aromatase inhibitors, which don't rely on the CYP2D6 enzymes. So the takeaway, if you're using tamoxifen to kill cancer, go ahead and use them concurrently. If you're using it to block estrogen, then use caution, monitor, and work with a clinician to understand how to best do this.
Okay, so cannabinoids and immunotherapy. So there's a lot of different types of immunotherapy that are out there. And basically, what does immunotherapy do? It revs up the immune system, helps the immune system recognize and attack cancer more effectively. Well, the issue is we want immunotherapy to work. We don't want anything to stop that from working, but high doses of THC or CBD may suppress the immune response. So high doses of cannabinoids may interfere with the antibody production critical to this type of treatment. The side effects of immunotherapy include fatigue, fever, skin reactions, joint pain, autoimmune reactions, and cannabinoids can be very beneficial in treating some of those side effects. So when patients are undergoing immunotherapy and want to use cannabinoids, we generally create a care plan for immunotherapy days that they're using it and then days that they're not. So if you're using high dose RSO, we generally tell people to take a little fast from it. Stop 3 days before and 3 days after immunotherapy, but use the cannabinoids in a way, the minimum effective dose to treat symptoms such as pain, sleep, anxiety, nausea, and appetite. And there is a way that you can do that. And we've been doing this for years for many patients. This is another slide that just shows the depiction of the difference between, and we're going to get into receptors in just a minute when we talk about the plant. This is just the cannabinoids in breast cancer showing the anti-tumor effects via CB2 receptors on the immune system by CBD decreasing proliferation, THC increasing cell death, CBD and THC increasing cell cycle arrest, CBD and THC decreasing inflammation, and then CBD decreasing tumor vascularization. And then the psychotropic effects, think about those, are happening in the brain, right? And THC in particular is very amazing for decreasing neuropathic pain, decreasing nausea, and decreasing anorexia in those patients that use this.
Yep. And again, this is the Cannabis Cancer Connection, a phrase from Joe Goldstrich, who authored this book and did a lot of research and direct patient care with Anselda's patients as well. After reviewing all the research, I have concluded that the claim that THC stimulates the growth of human estrogen-positive breast cancer is not supported by published peer-reviewed scientific literature. However, CBD appears to be the most potent and beneficial cannabinoid above all others for healing breast cancers. And we're going to get into that next.
So cannabis in cancer aftercare, there's a huge gap in research. There are no formal guidelines for cannabis use after completing cancer treatment, but we do recommend continuing. We've taken care of, over 6,000 patients in the past 10 years. And those patients that stop using cannabinoids, their cancer has come back. I've seen it a couple of times with some patients that we've worked with. And many patients use cannabis for ongoing symptom relief. There's no clinical evidence for preventing or preventing recurrence or sustaining cancer remission. Although the patients that we have taken care of that are using cannabinoids ongoing are remaining in remission. So there is an urgent need for evidence-based, integrative, and holistic survivorship planning for whole person care. But cannabinoids from the cannabis and hemp plant may be used as a wellness tool with lifestyle as medicine, post-cancer for residual symptoms, and to promote the relaxation response for ongoing healing. And we're going to talk about in the next coming slides how that works.
And all of you, I want you to grab your phone and scan that code right now. That's going to take you to cancer.gov. This is the NIH repository of cannabis and cannabinoids, the health professional version. There's also a patient version, but this is an aggregate of all of the studies, and they really do a good job at putting it in layperson's terms. You could spend an entire weekend just reading this page, and for those of you battling cancer, I suggest you do so and bookmark it. Come to it often because it's always updated.
So now we're going to shift from the research to the botanical side of this marvelous healing plant. So this is one of the richest plants on the earth. It's the most misunderstood plant on the earth as well. Over 1,500 natural compounds. And if you look at those beautiful purple flowers, in those little flowers, there's little resinous glands called trichomes, and that's where the medicine is located. The cannabinoids, terpenes, flavonoids, cannaflavins, essential fatty acids are the medicine. And they all have a therapeutic potential in the body to do something. And the pleiotropic effect equals that effective efficiency that we talk about to affect many physiologies, many symptoms, many conditions, all at the exact same time. So the phytocannabinoids from the cannabis and the hemp plant mimic the endocannabinoids that we make in our body upon demand to correct cell signaling to keep the body in balance or homeostasis. So cannabinoids are molecules that interact with the endocannabinoid system, and they come in 3 different types. We have endocannabinoids that we make internally. Anandamide and 2,8-G are 2 examples. the phytocannabinoids that are made externally in the cannabis and hemp plant, THC, CBD, and the minor cannabinoids, and then the synthetic cannabinoids that the pharmaceutical company makes, Marinol, Epidiolex, and Sativex. So THC and CBD from the cannabis and hemp plant, those are the phytocannabinoids that mimic our own endocannabinoids to activate the endocannabinoid system. The phytocannabinoids from the cannabis and hemp plant are 10 times stronger than our own endocannabinoids, lasting several hours, as opposed to the microseconds of the life of anandamide and 2-AG. And as you see here in this image, the THC molecule from the cannabis and hemp plant looks very similar to the anandamide molecule that we make in our body. And those actually plug into the nerve receptor. So they're very similar. This allows THC to mimic anandamide by connecting to the nerve cell receptor in its place to initiate a change, telling the body to either do something or not do something, bringing the body back to balance. So I always love, this is my Green Nurse umbrella, the endocannabinoid system receptors are everywhere. And the reason why I have this umbrella is just to show the interconnectedness of our body, all of the receptors, the neurotransmitter signaling systems, and the endocannabinoid system is that system. It blankets on top of our entire umbrella. We have cannabinoid receptors on all of the cell surfaces of all of our 11 organ systems and at the neurotransmitter signaling junction site. And the endocannabinoid system is like a switchboard sitting on top of every other system. It's sensing, it's listening, and it's steering our bodies back into balance by releasing the endocannabinoids. So just imagine you are made up of 30 trillion cells broken down into 11 organ systems, your immune system, the neurotransmitter signaling systems, all being regulated by the master regulatory system called the endocannabinoid system. And we're going to get into that in more detail.
So we all have our favorite slides, and this is mine. So the CB1 and CB2 receptors, where are they? Well, CB1, think about the brain and central channel, all of your mind, your motor functions, your pain, appetite, digestion, etc. And then CB2 being mainly in the immune cells, the spleen, thymus, all of your immune. But honestly, there are CB1 and CB2 receptors on just about every one of your cells. And what they do is provide retrograde signaling, or that feedback pharmacology. Imagine if you couldn't get messages back and forth. What this does is it has three parts. So there's the receptors, the endocannabinoids, and the enzymes that synthesize and then break them down. And retrograde signaling is a fancy way of saying just return messages. So most of our transmission goes from the presynaptic to the postsynaptic, but the endocannabinoid systems are sensing, listening, and responding when there is an erroneous transmission, too much, too hot, generally at downshifts, plugging into CB1 and CB2 receptors, and then reprogramming that cell to come back into balance. And what happens when we don't have these three components working effectively? We get deficient. Messages don't get relayed, and the body malfunctions, hindering our ability to adapt to outside stressors and the continuing stress that we have in our own bodies. We get sick, chronic conditions, and then cancer is one of them. The causes of an ECS deficiency is, the number one is aging. When we're about 25, we're chock full of these, we're balanced, everything works great. But as we age, that slopes off. Then there's genetics, which can play a factor in accelerating that. Poor diet, lack of exercise, obesity, stress, trauma, poor sleep, smoking, drinking too much, polypharmacy, a lot of those pills aren't doing us any good. And then diminished social interactions, lack of love, touch, and laughter. So we need to reverse all of this to come back into balance naturally, and then supplementation can come into play. And pleiotropic is one of my favorite words because it is that effective efficiency. If you see CBD here, you'll see that it's antipsychotic, anti-epileptic, anti-ischemic, anti-proliferative, anti-cancer, anti-diabetic, antibacterial, anti-inflammatory. There are over 40,000 studies that show that CBD and the minor cannabinoids will be used to modulate disease, and this doesn't even include THC. But all of these have a big play in that feedback pharmacology and helping us in supplementation.
And so again, this is from our handy dandy CannaKeys THC research dashboard. Gosh, look at all those studies, over 2,000 studies. You know, THC is a multi-targeted molecule that binds with numerous cell receptors throughout the body, particularly CB1 and CB2 receptors. Remember the image that Elizabeth showed you with those little dots, right? Marinol is synthetic THC, and this was approved by the FDA in 1985 for the treatment of nausea and vomiting associated with cancer chemotherapy. The issue that a lot of patients have when they've used Marinol, they've told us, is that it causes dysphoria, right? It doesn't make them feel good. They're like, yeah, it just doesn't feel the same as regular cannabis, not like the whole plant.
But there are lots of studies.
But there are lots of studies. So there is clinical evidence for using THC for these conditions. These are all live links that go to real live research studies. And you can see that cancer and cancer pain is right in there. It's clinical substantiation.
And we love CannaKeys. We get a lot of our research there. It's always updated. So we advise you to subscribe to CannaKeys. And CBD is also a multi-target molecule. It doesn't bind necessarily to CB1, CB2. It's a partial antagonist or a allosteric modulator, but it does bind to about 70 different receptors throughout the body, nudging all of them to usher in changes in our body, mind, and spirit. Epidiolex was approved by the FDA in 2018. It is a purified version of CBD, and it is for seizure disorders that don't respond to other pharmaceuticals like Lennox-Gastaut and Dravet syndrome. But as you can see, there are over 180 clinical trials with clinical evidence for all of these conditions, including breast cancer, cancer pain, and everything else that is on this list.
So now we're going to get into
another favorite book.
Yes, Eat, Sleep, Relax, Forget, and Protect. So this was a phrase that was coined by endocannabinoid researcher Vincent DiMarzo in 1998, an amazing book that was written by Dr. Michelle Sexton in 2023. And the reason why we want to talk about Eat, Sleep, Relax, Forget, Protect is because it really, truly explains the endocannabinoid system in a way that we hope you all will understand. So Dr. DiMarzo speculated that the endocannabinoids function as stress recovery factors, and they're all survival based. Our autonomic nervous system is modulated by endocannabinoids, and our autonomic nervous system is things that does things automatically on its own without us thinking. You know, is modulated by the endocannabinoids seeking to balance all the physiological systems in our body. And so the concept of Eat, Sleep, Relax, Forget, Protect holds significant meaning for health because the endocannabinoid system is that network of receptors and molecules found throughout the body that regulates all the various physiological processes that include mood, memory, appetite, pain, and sleep. And these are things that people are dealing with when they have cancer. So eating, first up is eating, appetite and metabolism. So the endocannabinoid system signals everything in the gastrointestinal tract: motility, acid fluid balance, dilation of blood vessels, nerve conduction, muscle contraction, motility, alerting us when we need to take in food. And so appetite and metabolism, there's different cannabinoids and cannabinoid combinations that can be used to work on different things. So if someone that has issues needs to stimulate their appetite, or if have issues with nausea, you know, we look at THC and CBG together or independently, but primarily those are the two cannabinoids that people work with. People are looking to suppress their appetite or to lose weight. THCV and CBD are really great for diabetes, weight loss, those things, gut microbiome health, GI health. You know, your enteric nervous system runs from your mouth to your butt, communicates to your central nervous system via the endocannabinoid system. So CBD and CBG tend to be superior in helping improve the gut microbiome. And then there's helpful cannabinoids that can be used for specific conditions, as you can see that are here. So, you know, a lot of patients that have diarrhea, the high dose THC oils can slow down motility. A lot of patients that have constipation, high dose of CBD oils can speed up motility. And then with nausea, we teach people, you know, to take one puff out of cannabis, you know, vaporizer, you know, to relieve that nausea so they can get in the other oils, capsules, and modalities. And then we have sleep, resting and restoring. So the endocannabinoid system does regulate our circadian rhythm, our body's internal clock that governs physical, mental, and behavioral patterns over a 24-hour cycle. And this includes sleep-wake cycles. So you think about what is the cornerstone of a good night's sleep? Well, the ease of falling asleep, staying asleep, having that deep restorative sleep, REM dreaming, waking up feeling refreshed with no residual drowsiness in the morning. And a lot of times when people come to us looking to use cannabinoids for sleep, we try to get them out of the mindset of just dosing right before bed. Your endocannabinoid system is going on and off all day long. And so you want to modulate the stress response during the daytime. You want to use cannabinoids that can promote daytime energy, but at the same time promoting the relaxation response. And then in the evening, folding in THC, CBD, CBG, CBN in various ratios in the evening, stacking different cannabinoids with various routes for different effects. So people have trouble falling asleep. Inhalation and tincture is generally where we start because it's the quickest and it's the easiest. If people have issues staying asleep, edibles, soft gels, capsules are more long acting. And some people have the whole shebang, have difficulty falling asleep and staying asleep. So we teach them how to stack all of these different products at different times in the evening to help them get what they're looking for. It's different for everyone. But relaxation, modulating anxiety and fear. The endocannabinoid system signals both the fight or flight response and the relaxation response. Stress brings people to cannabis. Anxiety is the number 2 reason. Pain is the number 1 reason. And the research has confirmed that high CBD, low THC products are the safest and most tolerable options for anxiety. Full spectrum CBD products are the best starting point, adding in 1 to 2 milligrams of THC as tolerated. And then there's the other cannabinoids, minor cannabinoids, CBD, CBDA, CBG, CBGA. These can all reduce anxiety without cognitive or sedating effects. And in certain cases, CBD can counteract some THC-induced anxiety. CBG has been studied in clinical trials that can help reduce anxiety, and it helps the endocannabinoid system produce its own anandamide molecule, that bliss molecule that mimics THC. THC is effective, but at lower doses may cause anxiety at higher doses, especially in sensitive individuals and people that are new to cannabis. And consumers generally do best with more CBD than THC when it comes to all anxiety types across the board.
Okay, so now we're going to shift to forget. So learning, memory, being able to learn new things and to forget. And this largely focuses on CB1 in the brain. The endocannabinoid system supports learning and memory by activating the hippocampus and the amygdala. It helps us learn, store, recall, and modify our experiences. Cannabinoids for this is going to fold in THC, but with a biphasic nature. Biphasic means a low dose versus a high dose can do different opposite things. So low doses of THC can help reduce pain at CB1, and high doses can actually intensify pain. Low dose THC can boost memory and cognition. So 1-2 milligrams can actually make you feel sharper, but high doses of THC, that 5, 10, 20 milligram, impairs CB1 and the working memory, causing the stoned, forgetful feeling. So if this happens, reduce the THC and add CBD to balance it out. Then THC helps us forget, trimming old memories in our brain that mainly occur during sleep, making room for new learning the next day. And THC also inhibits acetylcholinesterase, which is an enzyme breaking down acetylcholine. And that helps us with our memory preserving neurotransmitters in the brain. THC can also stimulate BDNF, brain-derived neurotrophic factor, boosting neuroplasticity for learning and overcoming fears, phobias, and addictions, and balancing THC with CBD and other minor cannabinoids can help you maximize the benefits and minimize the harms or risks of excessive THC. On the protect side, this is our CB2, our immune system. The ECS helps regulate our immune system to eliminate anything that is foreign or not me across the body. CB2 receptors, which we talked about earlier, are more highly expressed on 6 cells. It's like you have a door in the doorbell, and there's lots more signals expressing on that membrane, asking for the endocannabinoids to correct cell signaling. The ECS senses what is needed, and it sends those messages or feedback back and forth to restore balance. The endocannabinoid system deficiency that many of us run causes errors in this communication system, which then fails to repair the body, which is why we can supplement and get these compounds in our systemic circulation. CB2 receptors on immune cells release endocannabinoids to regulate the immune system and fight infections, and this is the role of the WBCs. CB2 receptor activation can result in anti-inflammatory effect, reducing pain and also inhibiting cytokine production and suppressing immune cells or cancer cell proliferation. And cannabinoids act as immune modulators, suppressing or stimulating the immune system depending on need, sort of like pushing the gas, pushing the brake, and sensing always what's going on. And multiple cannabinoids found in cannabis, hemp, and some nutraceuticals like echinacea, BCP, beta-caryophyllene, and PEA can all help activate CB2.
Okay, so the Rick Simpson oil, I'm sure, I'm gonna, if I asked, who's heard of Rick Simpson oil?
Who's on it?
Who's on it? Who's, or if you've been in the groups or you've seen it. So the Rick Simpson oil, the high dose THC oil, Phoenix Tears, full extract cannabis oil. There's a lot of groups that are out there that are teaching people how to use this in a way. And they, over 7 weeks, they'll get you up to 1 gram, 1 gram, that's, get in 60 grams in 90 days. And they give you 7 weeks to get there.
And some people do it in a week.
And some people do it in a week and some people don't do it in a week. And a lot of people that we've taken care of that have tried it, prior to coming to us have had bad experiences because it is high dose of THC. And it can be very, it can cause the dysphoria. Too much elevation is not good over time. And so basically we can teach people how to get to there if they want to use Rick Simpson oil, but we don't do it in 7 weeks. We teach people how to do it in 12 weeks. And the reason why we teach people how to do it in 12 weeks is because oftentimes you don't need as much as you think you need. And we've taken care of a lot of cancer patients that are in remission. And there's only a couple that I've known that have actually gone the full 1 gram route. A lot of people, will get up there in their milligrams, but essentially the majority of the patients, they're using a lot of the other botanicals, the other minor cannabinoids, terpenes, nutraceuticals to help kill the cancer cells so they can keep the THC dosing low, because it is not, the THC can make you impaired.
Yeah. And so when we talk about these concurrent therapies, especially with RSO, remember cannabinoids are potentiators, and this is why they can help make pain pills much stronger so you can use less of them, wean off opiates, but they also potentiate chemotherapy. So this can allow for lower chemotherapy dosing, which would allow for less side effects. However, if it potentiates the effects, it may also become more toxic. So patients should lower the dose of cannabinoids during chemo days. And the same thing applies to immunotherapies. The goal of them is to flame and rev up the immune system with pharmaceuticals such as Keytruda and Opdivo. And high doses of THC and THCA can suppress the immune system. Remember, it's anti-inflammatory. It suppresses things. So hold the RSO during cancer treatment days with immunotherapies. And we advise people to use THC 25 milligrams a day for comfort dosing, CBD 100 milligrams a day for overall wellness support, but not to flood the cannabinoids on those treatment days. So you need to have a care plan for treatment days versus non-treatment days, and working with a cannabis clinician can help you do that. And of course, once you do get that NED or no evidence of disease, you need a maintenance dosing. Cancer and serious illness, most of the time we tell people you're going to be taking these the rest of your life, but it's going to be a half of the dose that you were taking, or maybe even a quarter in subsequent years, but half dose of THC, CBD, CBG, the acidic versions, THCA, CBDA, CBGA, and of course adding in BCP, beta-caryophyllene, which is a non-impairing terpene, is always advised. It activates CB2 receptors directly, and it is a very wonderful product that many patients love.
So shopping for products, what we do here as nurses is we teach people how to build their own toolkit using multiple different products. It's not just about one thing, but it's about using a whole shebang. So I'm going to talk about the whole toolkit here. So when you think of topicals, I want you to think outside, right? Lotions, creams, balms, salves, roll-ons. It does not get into the systemic circulation. but it acts locally on the area. Onset can be anywhere from 5, 10, 15 minutes, duration up to 4 hours. Tinctures, on the other hand, are a different type of medication that is formulated. Oils or drops that are in a little bottle that have a dropper in them. You pull it up and people dose it sublingually. So sublingual means under the tongue. You have a vein under your tongue. You have a lot of receptors in your mouth. I want you to think of your mouth as a sponge. And when you drop it in your mouth, you're going to hold it under your tongue, swish it around in your mouth for 30 to 60 seconds and then swallow. Onset is anywhere between 30 and 60 minutes. Duration can be up from 6 to 8 hours. And we always, 4 to 6 hours, sorry, for the tinctures. And then with people that are new for THC, just start off slowly, start low and go slow. And we'll be talking about that in an upcoming slide. Edibles, on the other hand, think of capsules, gummies, candies, drinks, baked goods, butters, oils that can be dropped onto food. There's a lot of different edibles, and those take a little bit longer to metabolize through because they have to go through your gut, right? You think of your stomach as your digestive tract. Anywhere from 30 to 60. My mother, it took her 90 minutes to metabolize it. Duration is a lot longer, 6 to 8 minutes. And we always say to be cautious when you're new using edibles, specifically with THC in them, because the THC converts in the liver. So the delta 9 THC turns into delta 11 THC, and it plugs in a little bit tighter to that receptor, making it last a lot longer. So edibles are really good for long acting. And then we have inhalation. Inhalation is the most popular way that people use cannabis as medicine. However, we like to use inhalation as needed, not as the primary way. There's better ways to be using this plants, but we don't object to it. You know, think of the flowers, oils, concentrates. An example of different durable medical equipment is joints, blunts, spleefs, pipes, bongs, one-hitters, vape pens, dab rigs. The safest is the dry herb vaporizer. So a dry herb vaporizer that you get where you actually ground up the flowers, you put them in the dry herb vape, and you inhale that way. So you're not combusting. And the onset for inhalation is the quickest because it bypasses the gastrointestinal tract. 1 to 2 minutes. Duration is 1 to 4 hours, depending on how many puffs you take. And generally, when people are new, we teach people 1 to 2 puffs is enough. 1 puff is equivalent to 1 to 2 milligrams, depending upon the strain and the type of product that you have. Pause and assess how you feel. So where do you purchase all of these? Well, cannabis CBD and cannabis THC products needs to be purchased at dispensaries, but hemp-derived CBD products can be purchased online retailers or CBD shops. And we're going to talk about safe shopping in an upcoming slide.
And just like any medicines, there are potential side effects, but with cannabis, it is really dose dependent. And that means how many milligrams and how often you're using these. With CBD, they found in the Epidiolex trials that they can cause high liver enzymes, sedation, some diarrhea sometimes, but the parents never wanted to stop it because it was working. CannaKeys review said, that there's some dry mouth and fatigue for some people. Most interactions occur at 100 milligrams or more a day. On the THC side, you can have those, mind, memory, emotions, motor function changes, drowsiness, dizziness, tachycardia, fast heart rate with THC. And again, this is dose dependent. THC interactions generally are pretty mild, under 20 milligrams a day, and that is our safe zone. And you wanted to talk about the side effects versus the effects.
So the side effects versus the effects. So oftentimes the side effect for one consumer might be the effect that another patient or consumer is looking for. So the patient that has ALS actually welcomes the dry mouth because they're drooling. The patient with glaucoma welcomes the red eyes because it actually shows the vasodilatory effect of the cannabinoids. Red eyes actually shows that your vessels are dilating. The munchies and increased appetite for the patient that's nauseated or cachexic and can't eat. The patient that's hypervigilant or has issues with insomnia welcomes the drowsiness and the sleepiness. The patient that has PTSD welcomes being forgetful. And then the patient that's depressed welcomes the euphoria. There's really nothing wrong with feeling good. Euphoria is not a crime. Dysphoria is a crime in this day and age with what we know. And whole plant formulations, microdosing, and working with cannabis clinicians can decrease the potential for side effects. And that's why we're here.
And safety in dosing, you want to find your minimum effective dose, which is that Goldilocks dosing, the sweet spot. So it's the lowest dose to get the therapeutic response, but not too much to cause impairment or side effects. Start low, go slow is the code here for especially THC products. You want to microdose all of these products to mimic the endocannabinoid signaling going off all the time, looking for that cell signal corrections, breakfast, lunch, dinner, bedtime, and as needed. Use CBD during the day for the most part, THC in the evening and bedtime. One-to-one oils, it's a workhorse, CBD, THC as needed. Stacking products helps with cost effectiveness as well as keeping the tolerance low for any one product. And so mixing and matching that toolkit. And then safety with other pharmaceuticals. We mentioned some liver enzymes earlier. This is the CYP450, which is the parent organization of the liver enzymes. Drugs that interact with grapefruit can be more prone to interact with cannabinoids. And so what we always recommend is dosing at least an hour after the medication. So I tell people you wake up at 7, take your pharmaceuticals, have breakfast, hydrate well, 8 or 9 o'clock, take the cannabinoids, and that sort of a thing. So journal, track your results, talk to your providers, be open with them, and call the nurse line for any questions.
And then supporting the endocannabinoid system. So these are different tips, tricks, hugs, and nugs that we use with patients that come to us. You know, people come to us in crisis, struggling, barely surviving, and we help people get into the thrive zone. Cannabis and hemp products do support and nourish the endocannabinoid system, and so do these other activities. And so a lot of times when we're working with patients, you know, not only are we doing the basic assessment, but we're doing the holistic assessment. Are you including these activities in your life? And oftentimes patients will say, well, gosh, Sherry, I've tried all of those things and none of them are working. So I always invite people, you know, to look at this list. And if you're using some of these things and they're not working to your full potential, once you add in cannabis and hemp plant, I invite you to re-explore some of these activities because they do work. And there is research to substantiate that they do support and nourish the endocannabinoid system.
Absolutely. And lifestyle as medicine is, you know, one of the great things we do as nurse coaches. Serious illness needs a multimodal approach, conventional care, cannabinoid care, and other plant medicines, holistic care with self-care practices. Lifestyle tips include, what do you need to learn? What's important? How do you focus on meaningful activities and get rid of the rest for a while? Love, create and maintain deep relationships that satisfy your soul. Quality connections matter over quantity. Relax, remove yourself from stressful situations and keep your body in the relaxation zone to heal. Sleep, foster deep, restful sleep. 7 to 8 hours is needed for better healing. And eat whole foods, plant-based. Remove all the processed foods. And if you want to start anywhere, this is it. The Mediterranean diet is the best bet for healing. Move on a daily basis, get activity to increase strength, flexibility, and circulation. It doesn't have to be intensive. You don't need a gym. You can take walks outside, do some YouTube home exercises. And B, connect with a higher power, spend time in nature, meditate, and feel part of the whole. These are the fast track back to health. And when we talk about shopping for safe CBD, you want Green Nurse approved. Cannabis CBD is 0.3% or more THC, and you can find those in a dispensary. Hemp CBD is 0.3% or less THC, and this is found in online shops. And there are different types of CBD depending on how much THC is in. You want to do business with a company that offers transparency with a website, address, email, phone, customer service. GMP or good manufacturing practices are preferred. Certified organic is as well. And you want to have a certificate of analysis showing that everything has been lab tested for purity, potency, contaminants, and residual solvents. Accurate labels is very important. That 30 milliliter bottle could have 300 or 3,000 milligrams in it. And it makes a big difference whether you're ingesting 10 milligrams or 100 milligrams in that dropper. So knowing the potency helps you be safe. And then call the nurse line 970-404-HOPE or 4673 for questions on many of these things. And shop.
And there we go. And so Vera is here today. Vera Ventura, yes, she is. She's reconnecting at this moment. And this She is a 4-time cancer survivor, and she has a beautiful breast cancer goddess nonprofit that we have been educating on. And so we're offering our services to her and her ladies. And so we have the Bloom Hemp shop. You can scan and go right to the shop. Use Goddess 20 for 20% off. It's 20% savings, and then 20% is paid back to the Breast Cancer Goddess group. So what makes Bloom Hemp a little bit different? Well, it's woman and nurse owned, organic hemp CBD, doctor and nurse formulated, Ayurvedic inspired products, symptom targeted formulas. We have a free nurse line. We have a pharmacist on staff that answers the phone when we're not able to. Free care plans. We have a free network to teach people and to support all of the goddesses that are looking to use cannabinoids.
And if you want to get started, scan this free care plan side. It'll go right to the services tab, fill out the intake form, and we will reply.
And again, this is, the Breast Cancer Goddess support group that we are supporting, Goddess 20 for 20% off. This video will be recirculating. You will get an email when the webinar is done of a replay of this webinar. And
continued savings and continued support of the Breast Cancer Goddess support group.
And then we also have a new blog out on Substack called Ask the Green Nurse. And I started this, in January. And you can email info@bloomhemp.com or info@holisticcaring.com to ask your questions. And I may choose your question as a blog post. And so that's what I've been doing. People have been writing to me. I always write back. We provide the information, the education, and we substantiate it with research and links. And then if it's a question that I'm getting over and over again, I will post it up on the blog so you can all read, so other people can have access to the information as well.
And my goal is to get her syndicated this year. So if you know any newspaper people, we want Ask the Green Nurse to be in, just like Dear Abby, or it's Dear Sherry, she is the Green Nurse. So you can also get a free medical cannabis guide at Holistic Caring. This is just a screenshot of one page of it, the cannabinoids, the routes, the endocannabinoid system, how it all works. And you can subscribe to our newsletter and download the guide at holisticcaring.com. And that is right there. You can click that link. And we do practice patient-centered care here. I've been doing this for 40 years. 10 years in plant medicines, and we've created this ecosystem to hold the structure and the framework for all the products and services that patients need to be successful with cannabis therapeutics. Join our free network. That QR code will take you right in. There's a free Introduction to Cannabis program, a free ABCs of CBD course, a free patient portal to connect and chat with your peers, a free monthly plant medicine support group, clinical conversations, the webcasts and podcasts like you're on right now, the patient programs, which is our targeted e-learning library, and there is one on cannabis and cancer. And then the professional training and mentoring programs, our cannabis health coach programs, where we're training nurses and other providers. And again, call us 970-404-HOPE.